October 2025 drug testing reports released just days ago showed that the deadly cough syrup that killed at least 20 children had already failed quality checks at the Chennai lab marked adulterated in the official report. But what the public did not know is this. 2 more children's syrups failed quality tests in Tamil Nadu in the same month. Azini 100 and azithromycin suspension made in Nagapattinam failed the content test at the Madurai drug testing laboratory. And Lofi 250, a pediatric paracetamol suspension made in Trichy, failed its assessment test at the Puducherry facility. Now, these failures were never disclosed during the Coldrif crisis. Across India, the October list document 216 failed medicines, 211 non-standard quality, 5 spurious, and 13 liquid formulations for children, including 9 cough and cold syrups. Tamil Nadu alone flagged 17 substandard medicines, 7 by the Chennai lab, 9 by Madurai, 1 by Puducherry. Now, while these 2 syrups did not contain the lethal diethylene glycol found in Coldrif, failed assay and content tests mean that children may have been given incorrect doses from too little to treat infections to too much for safety. And to get more clarity on this entire subject, I'm joined by Dr. Sulfi Nuhu, who is a former state president, IMA Kerala. Mr. Nuhu, thank you for taking your time and joining me here at News9. Good evening. At the very outset, I have to begin by asking that we are not here to create panic of any kind because, of course, all the eager parents, curious parents are worried about the cough syrups in their houses. First, it was Coldrif, and now it appears there's azithromycin also that has failed certain tests. Azini 100 is another one, and Lofi 250 is another pediatric paracetamol that we're talking about right now. Mr. Nuhu, please give us clarity. What exactly is happening? Are these drugs safe for kids?
Yeah, actually, this is not at all surprising. We in the medical profession knew that a lot of drugs in the market, unfortunately, a chunk of them, a very big majority of them are, they don't have the quality required for the drugs. Unfortunately, very unfortunately, maybe less than 5%, maybe less than 2% of drugs sold in India are being tested for quality. That is alarming, but it's a reality. We need to look into this thing with a very long-term agenda. See, the thing is, we do not have the infrastructure, we do not have the facilities, we do not have the manpower to check all the drugs coming in the market. That is the truth. See, we are a very fast developing country and we need to have a long-term agenda on this, and we need to augment our system to such an extent that all drugs, at least a part of all drugs, must be tested, and so that those drugs will be safe. Regarding the cough syrup, regarding the antibiotics you said, and also many other drugs, and it's definitely a concern for not only for the medical profession, for the parents too. What we can do is that the only thing we can do is that we need to get the drugs from the quality drug selling centers, or maybe the medical stores, and also we need to make sure that the drugs which are prescribed by the doctors alone are getting to them. Even then, it may be having some kind of risk involved, but definitely, if you take the drug which is prescribed by the doctor, then the doctor, I think that he is also responsible for the drugs being given.
But Dr. Nuhu, I want to begin by asking that why is it failing the quality tests? Where is the shortcoming? Where is the regulation that is being missed in the process? How it is reaching the chemist labs and these chemist shops, going to the people's houses, being, if there is some issue with these cough syrups, why is it going undetected?
Sir, that's what I'm saying, sir. There is no system to check. That's the honor, that's the truth. That's the truth, the alarming truth in India. So,
But who is responsible for the checks, Dr. Nuhu? Is it the state level where the labs are? Or is it the Central Drug Control Authority that is supposed to check these before it reaches the shelves in the markets, in the chemist shops? Who is responsible for the checks? Where are the lapses?
Absolutely, it's both the state government as well as the central government, and we do not have a system. It is not that it is all of a sudden it all stopped. Nothing of that sort. We do not have a system. The thing is, in India, what the practice is that see, we are totally depending upon the doctor's experience. The doctors say that this drug may be good. This company has a good marketing. Maybe this good drug has a manufacturing history. This drug is maybe the manufacturer is having a very long the history in the market, and their drugs seems to be good by my practice, maybe my experience. The doctor believe in that, and he prescribes. That is the truth happening here. We don't have a check. When you check random, we find that a lot of them are of low quality. And even the most alarming thing is we say that we need to prescribe the generic drugs. But unfortunately, very unfortunately, most of the generic drugs being sold in India are of low quality. So we've been in the Indian Medical Association, and many professional organizations are pointing out to the government and authorities that we
Needs
need
to
to check
stop
that.
somewhere, Mr. Dr. Nuhu. And there seems to be no learning from this entire Coldrif episode that claimed several lives. We still go on to see substandard drugs, substandard cough syrups that can be hazardous for several of those young children who may have already been administered these medicines, who may still be there at the shelves. We don't even know about a faulty batch, a batch that may be undetected lying still at chemist shops. So do you feel that center should step in over here if it is going unchecked at the state level?
Yeah, it's the central government must definitely augment their system to check all the drugs, and also the state government. I think all the state governments, majority of the state governments in India, they when the news came out, they did they took some measures to check the quality of the drug and the pharma and all. In fact, they insisted in Kerala. What happened is, in the government has asked the drug controller. They came out with a order saying that you cannot give drugs to people without a prescription. And that kind of measures are there, but that will not solve the root cause. The root cause is there are untested drugs in the market. We need to have a system. For that, we need a lot of infrastructure. That is what I said. The problem is the health sector in India is being neglected as far as the financial thing is concerned. We do not have that much financial assistance, or maybe the financial support in the budget even. All the developing countries, please listen to this, all the developing countries, all the developed countries, they allowed at least 2% of their budget, their financial allocation, the budget allocation to the health sector. We are giving around 1%. With 1%, we cannot test all the drugs. We cannot do many other things.
Well, a country with a large population like us, and who has already seen the impact of COVID, where there were several people who lost their lives, can a country still afford something like this, where these labs and these batches of cough syrups are going unchecked, undetected, substandard, being administered to young kids? Dr. Nuhu is raising some very important questions over here. Both the state and the central government have to wake up and smell the coffee and ensure there is some system in place.